Ayurpreneur Academy, let me tell you why I founded this Ayurpreneur Academy. So the basic problem what I noticed is the Ayurveda education system is broken because we don't have clarity, we don't have competency, and most of us we don't make money out of Ayurveda exclusively using Ayurveda. I am speaking about the data what we are having, and how many of you resonate with this one, that the whatever the graduates they're coming out of Ayurveda, how many of them have got that confidence to make or earn money using purely Ayurveda or practice Ayurveda. Okay, so that is where the system is broken. We are producing the graduates, postgraduates, but still we are not sure that all of them they are going to make their career, professional career, especially with Ayurveda. Isn't it? How many of you agree with me? It's an open secret. Most of our students, we go for cross practice of allopathy medicine, and because of that, we suffer a social insignificance, professional insignificance, and time. There is lack of time freedom, and there is a lack of financial abundance. So the solution for this, what I felt is, if our students are given the clarity regarding the concepts and how it can be monetized, and if they are helped to develop the competency and how to monetize the things out of that knowledge and the competency, then that becomes a solution. So I thought that this Ayurpreneur Academy, and then the hub of the Ayurpreneur Academy, I founded an Ayurpreneur Lifestyle Hub with the sole intention of giving the solutions. Okay. The strategy is required for anything, any business or any career or any wherever you want to earn money, you need a strategy. For anything, for that matter, you need a strategy, a planning. And strategy for us as an Ayurveda graduates and postgraduates, we need a system which can guide us how we can monetize the Ayurveda, and a community to support us throughout our journey of being an Ayurpreneur, and a mentorship which will handhold us and that help us to get the clarity about the doubts, and at the same time the what you call. So with this intention, I founded Ayurpreneur Academy, and it has got the 60-minute and mentorship program is that, and community is there, and that is what the community Ayurpreneur Lifestyle Hub. Okay, mentorship is from me as well as the any stalwarts will be coming to share their knowledge on the Ayurpreneur Academy, and a system that is Ayurpreneur business model. Okay, so Ayurpreneur Lifestyle Hub, actually it has got the what you call what you call the purpose, that to elevate the self-confidence and self-esteem of the Ayurveda professionals, and a vision to empower Ayurveda professionals with concept clear mindset and competent skill set to build Ayurveda entrepreneurship, and a mission to help 1 million Ayurveda professionals to achieve and live entrepreneurial lifestyle using their Ayurveda knowledge and skills to accomplish social and professional significance, financial abundance, and time freedom using our Ayurveda business model. So what actually the Ayurveda business model is? The Ayurveda business model is a community support and mutual support of the 7 verticals or 7 experts of the Ayurveda. So it may be an integrative medical practice, it may be pure Ayurveda practice, it may be coaching of the Ayurveda and lifestyles, Ayurveda with the startups and technology-driven Ayurveda, and research and publications of Ayurveda, and even the Ayurveda farming. Okay. So what Ayurveda Lifestyle Hub offers is 6C membership benefits, where the community access will be there, courses will be there, certification, coaching, and consultation, and collaboration. So it has got a bundle of courses. I won't go into that. Okay. But our community is guided by the code of honors, the 7 code of honors. There is a conviction there should be conviction in the Ayurveda and in yourself, a clarity about the concepts and how to monetize it, competency to monetize your Ayurveda knowledge, confidence to go for the out of box thinking, consistency in approaching the entrepreneurship, collaboration with the like-minded people, and courage, okay, to take the advance, and freedom, achieve the freedom. So this is about the Ayurpreneur Academy and the code of the Ayurpreneur Academy and the Ayurpreneur Lifestyle Hub. And with this, the particular mission of helping the Ayurveda students, this particular Ayurpreneur Academy and Ayurpreneur Lifestyle Hub are founded. As a part of that, we are what you call the uh, conducting every Friday the what you call the Ayurpreneur mastermind sessions. Okay, as a part of that, you have joined the session. And today, see what I have basically bifurcated this Ayurpreneur mastermind session is the basic 7 verticals what I identified. It may be with integrative medical practice. It is pure Ayurvedic practice. It is with the coaching of the Ayurveda, either as a teacher or as a coach for the general public. Then fourth one is the startups. Fifth one is the technology-driven Ayurveda. Sixth one is the publications and research, and seventh is Ayurveda farming. So these particular Friday webinars will be revolving around these. So whenever I get the relevant resource persons, even I'll be calling them. Okay, I'll be calling them to. So brachial neuralgia, as I was telling, the whatever the relevance, you people will agree with me that this thing, the text neck posture was common, but it has become more common or more part of our life because of the post-COVID scenario. Isn't it? How many of you agree that the most of the population, even the non-technology people like us, we are now connecting or we are more on the online space or digital space compared to our physical space, isn't it? So because of that, this particular the COVID has impacted the market, the common public, and because of that, there is more indulgence in the what you call the tech mobiles and the screens, and because of that, the particular this pathological posture is adopted by many of the people. And because there are more problems related to neck pain, stiffness of the neck, as well as the shoulder pain and the upper limb pain, and which is affecting the productivity of all of us, isn't it? And this pain, many times from mild to it becomes so much severe that the people are they become intolerable and they cry out of the pain. And the same I had with my practical practice. Because of that, I was made to look into this particular scenario. So the prevalence rate, okay, when the whole world prevalence rate is taken, the brachial neuralgia, which is also called as brachial flexitis, it is around 1.64 cases per 1 lakh persons per year. Okay, so the person, the patients, they suffer, the age range from 3 months to 75 years. Okay. The overall prevalence of the neck pain in general population is 0.4 to 86.8%. That is a mean of 23.1% of the people. They suffer with neck pain at least once in their lifetime. Okay. And this particular prevalence ranges from 4.8 to 79.5% with a mean of 25.8% when it comes to a point of prevalence. Okay. So the estimated 1 year incidence of neck pain from all the available sources, it ranges from 10.4 to 21.3% with higher incidence, especially noted in case of office and computer workers. That what I was telling, the whole population is even the not for the professional reason, but even in the general day-to-day life, all the general public, they are adopting this particular what you call the text neck posture, which is especially the head forward bending along with the drooping shoulders and kyphosis, and that is resulting to the neck pain and neck stiffnesses. Okay, and the surprisingly, the more what you call the incidents are seen in the cold countries. So you can see here, okay, you can see here the red mark, what you're seeing here, Okay, that is the cold countries where the 6,000 to less than 6,200 incidences have been found. So that is it's called as national burden of neck pain, and that in general population, which is the survey was conducted from 1990 to 2017, it has suggested that the cold countries, especially the Finland and Ireland, they have got more incidence of the neck pain, that is 6,000 to 6,200%. I mean, so the cases are reported. So that indicates that there is the cold climate plays a more major role in case of inducing the neck pain, which coincides with our Vata Vikriti or the Prakop of the Vata. Where if you can see the what you call the Caribbean island, that is has got the least what you call the incidence, that is 2,400 to less than 2,700, and tropical countries also have got the less incidence because of the climatic effect. But acquired, that is what I call, that is the post test neck posture. Because of that, that is acquired neck pain is seen across the world without considering the temperature. Of course, Norway and Finland, because of the average temperature, which is minus 6 degrees Celsius to 1 degree Celsius in the month of January, okay, as well as minus 15 degrees Celsius to 5 degree Fahrenheit, okay, in case of February, all they may have more incidents compared to, because the climatic effect also affecting them, and because of that they will have this neck pain. Okay, but the rest of the countries, which in this, because this particular data is from 2017, that is before COVID. So before COVID, the tropical countries were having less incidence. They were having less incidence, but when it comes post COVID, this data may not hold good, and I am sure this data will be means it will be varied compared to the earlier. It will be different. Okay, with a lot of change ranges, there is differing range, and it may be affecting, or it may be the prevalence rate is found more even in the tropical countries, not because of the climatic effect, but because of the what you call the acquired text neck posture. So as I was telling, I stumbled upon the particular case. This lady of 35 years, she reported to my OPD when I was in Vadodara with a severe neck pain, especially with a burning pain, and it was so much intolerable for her. She was crying. And before coming to me, she was treated by an orthopedic surgeon for 7 days. Okay, 7 days with even intravascular diclofenac analgesic, I mean NSAIDs also, but still she was not having any relief, and there was no change, as she could not find any relief in the percentage of the pain. She reported to our OPD in the Ayurveda hospital, and I could make the combination of the medication for her. Okay, and skipping the allopathic medicine, NSAIDs I didn't use, and I used only the Antarparimal Chikitsa and Bahiparimal Chikitsa. In Bahiparimal Chikitsa, I could prepare Pradeha, in which included the Shastikashali, Musta, Yashtimadu, Gokshura, Khanda Sharkara, and we prepared a Yavagu and we applied on the Pradeha. It's like Pradeha, we applied, and surprisingly, within 24 hours, she could get the reduction in the pain up to 40%. Of course, along with the internal medication, what I had given was the what you call the Dashmula Kasha and Yoga. And this made me to think about the brachial neuralgia, and that gave me the confidence that the Ayurveda can also treat the acute pains also, acute conditions also. Of course, I suggested her some physiotherapy also. It was an integrated approach, but I was happy because the same in physiotherapy was also tried in the earlier clinician as of contemporary science orthopedician, but still there was no relief. But this lady got relief within 24 hours, and that helped her to get the confidence in Ayurveda, as well as even I got the confidence in Ayurveda, and I felt that especially with the Vata Vyadhis, we can give better result compared to contemporary people. So I published the article also on that, and you can see the drastic change from third day. Okay, that has drastically reduced to zero. Okay, which was grade 3 on the day 1. Okay, that came to 0 grade on the day of 7th. Okay, now the question arises whether this brachial neuralgia is considered as a symptom or disease? See, it is a syndrome rather. The brachial neuralgia happens to be syndrome, and this can be a symptom in many of the diseases, where the pain radiates from the arm with severe burning to the upper arm. Okay, from neck to upper arm, or the arm to the upper arm. So it is a retrograde, means from neck to the finger also it may radiate, or from finger to neck it may radiate in the reverse direction. So radiating pain will be there, and there is stiffness, cervical stiffness may be there, and pain will be there, and restricted limb movements and neck movement, and paresthesia to hyperesthesia. The range is from paresthesia to hyperesthesia because sensory nerves are affected, and muscle fasciculation can also be experienced by the patient. Okay, so these are all the clinical conditions where the cervical pain, especially radiating pain, is presented. So most of them, they are the degenerative disc disease, neck strain, okay, neck strain, where osteoarthritis can be the one of the cause, cervical spondylosis, spinal stenosis, poor posture, neck injuries, and a common infection can also cause this cervical neck pain. Okay, so where if you come to the names, particular names of the disease where the brachial neuralgia is seen, is the brachial neuritis, brachial flexopathy, idiopathic hypertrophic brachial neuritis. Okay, hereditary neurologic amyotrophy, neurogenic thoracic outlet syndrome, cervical spondylodiscitis, and coracoid impingement syndrome, and chronic spontaneous spinal epidural hematoma, which can be an acute condition, and cervical spinal stenosis, myositis ossificans progressiva, cervicobrachial neuralgia, thoracic outlet syndrome, personage-turner syndrome. See, why I am telling all these names? This is to identify where understanding our limitations and our advantages, both strength and the weaknesses at the same time. See, if I go directly to what you call the conditions of Ayurveda, which present with brachial neuralgia or pain in the neck and radiating pain to the down to the arm and the upper arm and the arm, the hand, then we may not understand what are the limitations or what are the advantages at the same time. Because see, when you have limitation, you have got advantages also. So I want to elaborate on these conditions so that you'll have a greater idea where the medical management can help the patient and where we need to refer the patient for surgical intervention. If we do this job honestly of identifying the conditions with what remedy they can be cured, whether by medication or by means of a surgery, even if we are able to do that, if we are able to guide the patient, that is a greater justice what we are going to do with the patient. How many of you agree with me? If you agree with me, type yes in the chat box. Okay. Because see, treating, the education becomes the first and primary part of any treatment. Now the Western science also feeling that, Western world, not rather science, rather the Western world is feeling that the patient should be the important, what you call the stakeholder of planning the treatment, because it ultimately he is going to receive the pain as a treatment, and he should be aware of what exactly the pathology with his body and how it can be corrected, what are the available remedies, and what is the prognosis. If the patient is well aware of all this, when the patient connects emotionally and logically and physically and spiritually with your treatment protocol, the results are astonishing and results can be achieved to the what to call the fullest. For that reason, you need to understand what happens in the brachial neuralgia. Okay, so brachial neuralgia basically it affects the what you call the nerve roots, especially C5 to T1. So the major nerve roots are C5 to T1, whereas some contributions are from the C4 as well as the T2 also. T2 also. So they are minor contributions, but major is C5 to T1. This makes a brachial, what we call the plexus. So brachial plexus, so the anterior rami of the fifth to T1. Okay, fifth to T1 all the anterior rami, they club together at different levels, okay, and they form the what you call the brachial plexus. So when it and the one it makes three trunks, that is superior trunk, middle trunk, and the inferior trunk. So all these C5 to T1, the anterior rami, they join together to make either superior trunk at certain level, middle trunk, and the inferior trunk. And these trunks, from the whatever tributaries they are coming, they are supplying the different part of the neck muscles, shoulder, suprascapular muscles, okay, trapezius muscle, and the skin, and the arm, and the what we call the till the fingers. So median nerve, ulnar nerve, and brachial nerve from the bifurcation you can make out. Okay. So if you go through this anatomy, okay, as I was telling, the contributions from the C4 are also there, contributions from T2 are also there, but they are minimal. But majority are the C5 to T1, the ventral rami are the contributors in the brachial plexus. And I told you the superior trunk, middle trunk, in the anterior, inferior trunk of their anterior divisions and posterior divisions, they take care of all the muscles which are in and around the neck. In and around the neck. Now, the yellow part is highlighted to make you to understand what are the muscles involved in the neck and the neck pain. The splenius capitis muscle and descending part of the trapezius, splenius cervicis muscle, levator scapulae, longissimus capitis, longissimus cervicis, spinalis cervicis, and semispinalis cervicis. Okay. So all of these, when these they play the role, and especially the nerve supply of that particular area gets affected. Now the two words are there. Okay, one is cervical radiculopathy and one the brachial neuralgia. So radiculopathy, the word is used from the nerve root. So when it is affecting only the nerve root, a particular one nerve, then it will be radiating as per the only that nerve course, and then it will be called a cervical radiculopathy. But whereas the whole plexus is involved, or where the compression is beyond that, when the whole brachial nerve is called plexus is affected, okay, at different levels, then it becomes brachial neuralgia. Okay, so cervical radiculopathy is one or more nerve affected, but still it is the basic is it is affecting the root. Okay, root of the particular nerve, whereas radiculopathy is comprising of the multiple nerve compressions. Okay, so the basic etiology can be bifurcated. I have bifurcated the etiologies which are causing the brachial neuralgia or the neck pain. Okay, neck pain. So it can be mechanical cause, it can be infective cause, it can be injury, it can be inflammatory cause, or it can be what we call the morphological changes. Okay, so compression happens to be a mechanical cause. So compression of because of the cervical spinal stenosis or some spinal tumor, there may be pain, which pain may start. Okay, that because now is compressed because of either cervical spinal stenosis or the tumor. The infections are also one of the causes for the acute or chronic neck pain. Like in case of meningitis, you must have seen the rigidity of the neck develops. Isn't it? Rigidity of neck develops in the meningitis. That's why one of the clinical test to identify meningitis is neck flexion test. Anteriorly, if the neck is not being able to, the patient is not able to flex the neck, the rigidity of the neck is there, or if the patient gets the pain, okay, then it is fever with this particular, usually suspected with the meningitis. Tuberculosis, especially suboccipital Pott's disease. Pott's disease, when the TB of tuberculosis affects the bone, that is called Pott's disease. Okay, so suboccipital Pott's disease, fungal infections leading to cervical spondylodiscitis and brucellosis can be the cause for the infective cause for the subbrachial neuralgia. Inflammatory causes are even the herpes zoster, which may affect the brachial plexus, and neuritis is caused, and that can become an inflammatory cause for the brachial neuralgia. And of course, as the growing age or because of the malnourishment, patient will have the neck pain, second degeneration, and degeneration may cause spondylosis, calcification, frozen shoulder, herniated cervical intervertebral disc, osteoarthritis of spine, drooping shoulders, girdle syndrome, non-traumatic atlantoaxial rotatory subluxation, because the atlantoaxial axial bone, they are articulating with the head and the neck, okay, the joint, and that becomes subluxation. That can also cause the neck pain. And spondylosis deformans and Crohn's dense syndrome, that is a calcification of the periodontide process. So these are all the degeneration causes which may cause the brachial neuralgia. Even malignancy can be the cause, because the metastasis from the lungs or the breast can take place at the around the tissues of the brachial nerves, and that may infiltrate into the brachial plexus, and because of that there may be compression on the nerve roots of the brachial plexus, and the pain may start. Traumatic causes as like a whiff flash injury, wherein the head first goes back violently and then comes forward with a jerk movement. And because it may be in case of accidents, car accidents or bike accidents, where a sudden violent movement of the neck takes place backward and forward. Okay, and that is called as a flash injury. That can be one of the major cause for neck pain or the brachial neuralgia in case of accidents, or even in case of bed, even in case of when you hold, okay, when you hold the sneezing or violent sneezing. Traction, okay, attraction which of the hand, the upward traction or the downward traction from of the hand can also cause the brachial neuralgia. Chronic spontaneous cervical epidural hematoma because of the trauma, okay, traumatic hematoma. If it occurs at hematoma develops at the cervical epidural area, that can be the that will be compressing the nose, and that definitely there will be pain. The neoplasms, that is jugular plevectasia. So jugular plevectasia means what? There is enlargement of the jugular vein without tortuosity, and that compresses on the nerve. Okay. Then that is anatomical. In neoplasm, preganglionic, postganglionic, retrophageal ganglioneuroma. And anatomical, as I told, the jugular plevectasia, carotid dissection, where the tear happens in the wall of the carotid, and there the blood gets collected, and then it becomes swollen, and then that may also affect pressure, put the pressure over the, and the what you call the nerves which are lying very close to that, and that can cause the cervical pain. Coracoid impingement syndrome, aneurysm. These are the anatomical deformities which may cause the brachial neuralgia. In the case of others, migraine patients may experience neck pain. Okay, and spontaneous intracranial hypotension can also cause the neck brachial neuralgia. And iatrogenic causes created or offered by the unskillful doctors or the technicians. Okay, that is, or the what to call the medical secondary to some other conditions like radiation induced brachial flexopathy and pseudo aneurysm of a brachial artery. Whenever the brachial artery, okay, is punctured, then there may pseudo aneurysm may take place. So the cervical spondylodiscitis, that is the inflammation of the disc and the vertebra, okay, can be the major cause for the space when it reduces the space in intervertebral disc space, and because of that compression and the pain will be there. And the infection causes more common are the staphylococci and mycobacterium tuberculosis. Okay, the stenosis, cervical spinal stenosis causes may be the posterior arch hypoplasia in bipartite atlas. Okay, this is congenital one, many of time congenital. Okay, and increased in size of ligamentum flavum that can be acquired, and degenerative arthritis causing excessive bone growth. Okay. Frozen shoulder, all of you know, there is a difficulty in movement of the shoulder because of there is a fibrosis of the rotatory capsule, that is glenohumeral capsulitis is there. The inflammation is taken place, and because of that, the initially patient will have severe pain and unable to do the functions of the shoulder, but over the period it goes into fibrosis, and of course it may get into subluxation, laxation of the glenohumeral joint, and that can cause the functional lacia of that frozen shoulder, and that is called as frozen shoulder, and contractures develop in the wrist joint and fingers in advanced conditions, and even muscle atrophies will take place because once they are not used, okay, the muscles are especially the infraspinatus, serratus, anterior, biceps, deltoid, trapezius, pectoralis major, and sternocleidomastoid, all of them, they in the later stage, advanced stage, if the treatment is not given earlier. So frozen shoulder is the basic one of the thing which we need to consider. So brachial neuralgia, right from the neck, okay, at the base of the skull till the fingertips. Okay, so anywhere, whatever the conditions they occur, most of them, they are falling in the what you call the neurological causes, neurological conditions, and that's why it is brachial neuralgia. Okay, most of the symptoms, signs, complaints, or the problems, they start in the neck, base of the skull, till the, which is with a radiating pain, especially, so nerve conditions. So sensory symptoms are also noticed there. So sensory symptoms can be the paresthesia to hyperesthesia to even allodynia. Allodynia means what? Even our cloth, the patient can get the pain only by touch of the cloth or the feather. Means the stimuli, which was not earlier causing any pain, that also become a painful stimuli for the patient. That is called allodynia. Such a severe, sensitive, hypersensitivity is developed by the sensory nerve fibers of the brachial plexus. So autonomous symptoms are also there. That is, the patient may notice vasomotor dysfunctions, tropical skin changes may be seen, edemas may be observed, temperature dysregulation may take place, the particular part of the arm, increased perspiration, trophic changes of the hair and nails, and more common in lower brachial plexus. Okay, so cervical brachial neuralgia due to ligamentum flavum calcification is also one of the cause, as I already told, where there is a deposition of hydroxyapatite or calcium phosphate, pyrophosphate deposition, okay, at the cervical vertebrae. That can be the cause for the. So here, one is the what you call the compression. The basic mechanical cause or the basic pathology is there should be either compression over the nerve or there should be an inflammation of the nerve. There should be compression of the nerve or inflammation of the nerve. So only these two are the basic pathological changes. They take place secondary to all these conditions. So conditions, the compression can be because of the neoplasms, compression can be because of stenosis, compression can be because of degeneration, compression can be because of infiltrations. Whereas inflammation can be because of the infection, especially with the staphylococci and mycobacterium, as well as herpes zoster or viral infections. Okay, and inflammation secondary to some other what you call the conditions which are frequently irritating that nerve fiber because of its mass. Okay, impending mass. Okay, so the thoracic outlet syndrome is the major one, which is also falls in the which also presents as a brachial neuralgia, and of course it is a part of that brachial neuralgia secondary thoracic outlet syndrome because the thoracic outlet is compressed either because of the extra cervical rib or a prolonged transverse process or muscular abnormalities, especially scaly anterior muscle becomes more taut. Okay, more stout and taut. And a sickle-shaped scalenus medius muscle. There is deformation in the scalenus muscle and fibrous connective tissue anomalies and hypomobile first rib. The first rib is hypomobile, it's not moving much. And because of that, there is a continuous compression over the artery, vein, and the nerve at the subclavian area. Okay, subclavian area, and because of that, there it is that the outlet is impinged, and because there's a pain is there. Okay, so neurogenic thoracic outlet syndrome usually that is a pain, paresthesia, as Allah told, especially at the ulnar aspect, and severity is again it increases as per certain activities, and it's more at the end of the day or during the sleep, and advanced cases of this neurogenic thoracic outlet syndrome are characterized by the objective signs of weakness of the hand. loss of dexterity of fingers, and atrophy of the affected muscles. That is, thenar and hypothenar get atrophied. Okay. So even X-ray may show some pan-coast tumor. Pan-coast tumor is the tumor arising from the lung, okay, lung, especially apex of the lung, and that is infiltrating into the nerve fibers. The investigation can make you to understand, okay, and they can reveal what is the problem. And the anatomical sense, as we are speaking about the coracoid impingement syndrome, where at the subcoracoid area, the what you call this, the tendon of the supraspinatus muscle gets inflamed, and that becomes and means occupies the extra space, and because of that, there is an impingement of the what you call the bursa. Okay, bursa so gets inflamed, and that gets impingement, and because of that, what happens? There is tendons of bursa. When they swell, they reduce the space, and because of that, there is a pain which is retrogradely felt in the cervical region. So, personage-turner syndrome is an acute brachial neuropathy and neuralgic amyotrophy. It's also called as a neuralgic amyotrophy, where the amyotrophy means where the what you call the muscles get atrophied. There is a muscle size of the reduction of the muscles. Okay, so this is the acute brachial neuropathy, acute and sudden onset of the pain radiating from shoulder to the upper arm. Okay, and this begins with the severe shoulder or arm pain, followed by weakness and numbness. This case, what I was discussing about that lady, and that lady I diagnosed with a personage-turner syndrome because it was an idiopathic. The patient was not having any evident etiological factors which can be directing us towards the anatomical changes. It was idiopathic. Okay, like we could not trace the cause, but there was severe pain. And personage-turner syndrome, it is many times self-limiting, but it goes even 6 months to years together. Okay, so the idiopathic brachial neuritis, where the condition is unknown, and there usually it occurs from 3rd to 7th decade. Men are more affected compared to women, and this will also have the infection may come, or the episodes may follow after the what you call the upper respiratory infection, a flu-like illness, immunization, or surgery or emotional stress can also cause the idiopathic brachial neuritis. So these things, when they're idiopathic, we have got a better role. We have got a better role to play as an Ayurvedic practitioner. Because when it is idiopathic, when there's no particular what you call the evident anatomical changes are there, okay, we can treat them by our Ayurvedic measures. Okay, so hereditary neurologic amyotrophy is again a hereditary. It's a autosomal dominant disorder. It's a very rare cases, and these are. But you need to keep in mind that if you are able to see a muscular dystrophy over the period, and along with that, the patient is having the pain, and just check it out whether any hereditary incidence is there or not. And post CA, especially carcinoma patients, especially carcinoma of the lung or the breast, if they come to you with a severe pain at the neck and radiating downwards, then you need, especially post radiation, if the history is there, the radiation has been given to them, you need to give a thought that it can be a radiation induced or a brachial plexopathy. Okay, where the limb paresthesia will be there, swelling will be there, and motor weaknesses and pain is less severe. But the pain and the paresthesia, lack of sensation, as well as swelling is more. And usually the swelling is also, especially in case of breast CA patients where the mastectomy has been done and followed by radiation, many times patient comes with an edematous limb of the affected on the other affected side because of the axillary cleavage of the lymph nodes has been done, and because that is also another cause for the swelling, edema. But the edema with the pain, if the patient comes, and the same history is there, okay, the radiation has been given, then you should check out with an MRI to identify whether it is the brachial nerves are compressed or infiltrated with, or they are fibrosed with an radiation effect, post-radiation effect, and that may be the cause for the brachial flexopathy. Okay. And traumatic brachial plexopathy, that is any trauma like stretch injuries, like the in the this right hand side, you can see the stretch injury has been depicted there. Okay, immediately, and especially I have seen in my during my internship, I could see that the patient was reported to one patient was reported to the what you call the casualty where I was working as an intern, especially at a neurosurgeon. Okay, the patient was brought with gasping. Gasping. Patient was not able to take the breath because there was what you call the uh, stretch injury, because he was at the barber shop. He was having his haircut done, and usually it is a practice that barbers they turn. Okay, they practice the what you call the what you call uh, they violently release the neck stiffness, and that led to the stretch injury for him, and there was a fracture of the atlantoaxial junction, and because of that patient went into a paraplegia, so called quadriplegia, and he was gasping, and a tracheostomy was done. He was lucky to survive with a tracheostomy, but he was quadriplegic. So such stress injury can be more dangerous, it can be fatal. Since then I stopped getting my neck what you call released by, or the neck stiffness released by the barbers. So compression injury can take place because of any pressure from the above or falling on the lateral side. Okay, so these can be the one of the flexopathies. You can see here the upper brachial plexus injuries with which is called as waiter step position. Waiter step position, usually waiters carry like this, no? So that is the where injury can be seen. And the lower brachial plexus injury, when there is a violent jerk at the upper limb stretched at the means upwards, the limb is stretched upwards, and even continuous or the long term means lying means what you call the relying or the leaning on the edge at which is compressing on the axilla can also cause the brachial plexus injuries. Okay. The metastatic brachial plexopathy, as I told, the metastasis itself may take place. Radiation is one thing that, but the metastasis itself can take place from the lungs or the breast, and that can infiltrate the nerve roots, and that can cause the plexopathy. Another condition is proximal neuropathies of the shoulder, where the what you call the suprascapular notch at the suprascapular notch, the transverse ligament, okay, that causes what you call the repetitive shoulder movement and positions, which and mass lesions can cause what you call the compression over that, and that may lead to pain, and especially this adduction to extended arm, the pain aggravates and weakness of the shoulder takes place, and that is especially with the abduction, shoulder abduction and external rotation supraspinatus influences, there is a delimitation. Okay, so that can be the one what you call the another cause for the brachial neuropathy, brachial neuralgia. And axillary neuropathy as what you call the circumflex, what you call the brachial plexus, that is a posterior cord of the brachial plexus, as per, and that gets what you call the affected, and because of that the teres minor and deltoid sensory deltoid muscle and sensory over the shoulder gets aggravated, and that the trauma or the accelerated brachial plexitis can be cause for the pain. And of course, musculocutaneous neuropathies are there, which has again originated from C5, C6. Okay, that can be there. And long thoracic neuropathy can be one of the cause. And spontaneous cervical epidural hematoma, as I already told. Okay, that can be the cause for the brachial neuralgia. And carotid dissection, as I already told, that can be this one. And jugular fibrillectasia, you can see here. And pseudo aneurysm of axillary, because that the iatrogenic, as I was telling. Okay, you can see that can be the another reason for the brachial neuralgia. And Eagle syndrome, styloid carotid artery syndrome. It is also called as styloid carotid artery syndrome, where the elongated styloid process compresses on the what you call the nerve. Okay, and sudden sharp pain is found at the patient's jawbone and joint and back of the throat and base of the tongue, triggered by swallowing and moving the jaw or the turning the neck. Okay, so this is the another cause for it can be radiating down, and that can be another cause. Herpes zoster, as I told, can be the one of the reason for brachial plexopathy, and that can be identified by this what we call lesions, skin lesions. Okay, so when it comes to brachial plexitis, it starts as a pain, okay, which is especially burning around the shoulder, and then it may rapidly increase in severity, and severe pain may be felt along with the sensory what we call dysfunctions, as well as the weakness of the limbs. Okay, and the serratus anterior deltoid biceps and triceps muscles are most of the time they are involved, and they may be paralyzed or maybe totally losing their functions. And distal muscles can also be involved. Okay, especially the what we call the forelimb muscles and the wrist and the what we call fingers. And recovery usually complete few months to 12 months, but if you help the patient to get rid of this pain at early, you'll be regarded as a god. So cervical osteoma is another cause for the brachial neuralgia. I won't go to get deep into that. Now, coming to the basic point, that is whether Ayurveda has got the answer or not. So in Ayurveda, why this question is relevant? Why this question is relevant? Because see, whatever the management plan is there, with the contemporary people, what is the management plan with the contemporary people? That is the conservative, they have got corticosteroids and NSAIDs. They have got basically corticosteroids and NSAIDs, and you know what are the basic, what they call the side effects and adverse effects of the corticosteroid and NSAIDs, and the, of course, they are what you call the demerits. If they don't, and after the conservative, directly they have got a surgery is the only answer. Like primary neurography, neurolysis, nerve grafting, neurotization. And all of them, they happen to be more expensive, and they require more longer what we call hospital stay, as well as the procedures and anesthesia risks. Okay, and excessive scarring, more morbidity rate with those surgeries, and more recovery time. And the third option is there for them, that is percutaneous radiofrequency thermoablation. But again, it has got very little what we call the result, because the whatever the result it is giving, that has got only, they could notice that only 60% result can be achieved, and that is also for a shorter period. So because when they have got the limitations, but still they are presenting with an authority, and especially patient doesn't want to get into a surgery, our role comes. So here we can identify, as per our classics, what can be the sort of condition as per our Ayurveda whenever patient comes to us with a modern contemporary diagnosis. So already we have found out what are the conditions that can give rise to the neck stiffness, neck pain, and brachial pain, shoulder pain, and the other what you call these symptoms like sensory or to hyperesthesia, paresthesia, or allodynia, or muscular weaknesses, muscular dystrophies, and the muscle motor weaknesses. So if all those conditions, if we can observe in our Ayurveda, where in which conditions these particular signs and symptoms appear, and if we are already we are having a modern diagnosis with us, when the patient comes to us, they come with a modern diagnosis. And in the modern diagnosis, if you can identify that there are limitations of the treatment, and the patient is not ready to go for surgery, and of course, surgery can be can be placed as a last resort for the patient, and with if it is not, if the condition is not life threatening, you can try with Ayurveda. And in Ayurveda, as per whatever my what you call the observation, we can consider these four basic pathologies in homologous with the brachial neuralgia. That is avabahuka or bahu shirshakata vata, manyastambha, vishwachi, antarayama, bahirayama. Why I consider antarayama, bahirayama is certain the antarayama, bahirayama, it is a progressive stage. The conditions in the antarayama, bahirayama, if you want to go through the classical explanation, it's not the end stage. It has got its own stages. its own stages. And if the patient comes to us in the early stage, where in early stage, Manya Stamba is more common, there we can use the Ayurvedic medication and we can give. Or even vice versa, in Manya Stamba, if the available the treatment protocol which has been given in the Manya Stamba is not giving the result, you can take the what you call the medical treatment protocol from the Antarayama or Bahirayama. Because in Antarayama Bahirayama, Manyastamba is one of the sign and symptoms. Okay, so the both four basic classifications. Because when you go to the Manyastamba, whatever the etiologies have been mentioned, they almost they associate with the what you call the neck pain and neck stiffness. So Divasapna, which increase the kapha, which and then make the avarna of the vata. Okay, and also asanasthana, that is the improper posture of sleep. Okay, urdhva nirikshana, looking at or changing the what you call the neck position under or prolonged abnormal neck position. As I was telling about the what you call the text neck. So okay, text neck as well as the improper posture in the bed, especially the pillows and the bed. Okay, acquired angle and sudden movement like whiplash injury. Okay, that which already pre-existing injury was there, and again the whiplash takes place. So all this can be considered to the what you call they are considered as a neck pain or the neck step what you call break, which are the causes for the brachial neuralgia. In Manyastamba also the same etiologies have been mentioned. And the Shleshmana Avrata Vata. So here, because of the Divasapna, okay, Shleshmana Avrata Vata, these three important factors you need to remember, because once we go to, already we have gone through the what you call the contemporary science pathology, where depositions or calcification depositions are also one of the causes for the stenosis of the spinal canal or at the atlantoaxial joint, that is periodontitis, isn't it? Atlantoperiodontitis. So there, what you call the kapha, Shlishmana or Vata can be either as a calcium deposition, can be as a what you call the soft tissue depositions, can be the other compressions over the nerve. Okay. So in the neck stiffness, the contemporary people they speak about the how to relieve the neck stiffness, especially sleep-induced neck stiffness. They have given 7. But the best important thing is that you need to keep the temperature comfortable. Means it should not be cold, or it should not be directly, or the patient should not be directly exposed to the AC vents or the fan. That means Vata Prakopa should not be done. Vata Prakopa should not be done. So even the some simultaneously they are speaking about the ice application heat therapy, but we need to think about the heat therapy more, because there is, of course, because the what you call the both Vata and Kapha, they are more sensitive towards the heat. Okay, so considering all these things, considering the Urdhva Nirikshana, okay, considering the improper posture in the bed, considering the Divasapna, okay, and that is with the text neck, because text neck, if you see the diagram what is being shown here, when you see your screen or when you read with an elevated hand at the eye level, the pressure over the neck muscle is only 10 to 12 lbs pounds. Whereas when it goes to 45-degree, okay, flexion, it increases to 50 lbs. And when it is beyond, okay, the 60-degree Celsius or the, sorry, 60, not Celsius, 60-degree angle, then the pressure or the weight, goes above. The weight is about a 60 lbs at the neck muscles. And that makes the forward head posture more vulnerable for the brachial neuralgia. Okay, so that causes the reduction, the degeneration over the period causes the muscle reduction in the muscle elasticity. It decreases with the progressive age. The progressive age is indicative of Vata Prakopa Kala or Vata Pradhana Kala. So Vata becomes Gunata Vriddhi and Karma Kshaya takes place, and because there is a stiffness of the neck. Okay, and even myofascial stiffness increase with the age and degeneration, where there is a deformations in the muscle shape, and that causes that is maybe secondary to the more external depositions. Okay, fibrosis in the muscle, and that is kapha can be the cause. Okay, so when you take a samprapti, if you would like to evaluate the samprapti, for example, if you take a crown dense syndrome, where the manyastamba is called as kapha vata is the major culprit. So if you take a crown dense syndrome as an example, the pathology says that calcification of the periodontite process is there, which can be related to increase in the Prithvi Mahabhuta and Ap Mahabhuta, and indirectly the kapha. It leads to kapha accumulation. Okay, or the future, the qualities of the kapha are considered. Okay, the calcium pyrophosphate dihydrate crystals, they deposit at the periodontite transverse ligament, and that leads to inflammation and arthritis, and that's definite, and then acute neck pain takes place, and it becomes more severe with the age beyond 50 years. So whatever the free crystals, they move into the what you call into the joint fluid, especially free crystals of the calcium, CPPD is calcium pyrophosphate dihydrate crystals. When they move, they are causing the sanga for the vata movement, and that leads to the what you call arthritis, atlantoaxial joint at the atlantoaxial joints, and that causes the neck pain in the elderly patient, which is because of the vardhakya, and pseudo gout arthritis features are seen. Okay, so the depositions play the major role in case of crown dense syndrome. This kapha and manyastamba can be compared. So manyastamba can be basically classified into two, that is acute and chronic. And in acute, whether we can consider kshavatu vega avadharana janya. Okay, so when kshavatu is there and violent, when the sneezing, it produces the pressure of more than 60 lbs. Okay, so 60, or sorry, not 60, 120 lbs, more than 120 lbs. Okay, that pressure is exerted on the muscles. If it is obstructed, we can imagine what amount of trauma can occur on the muscles and the ligaments of the neck. So kshavatu vegahodharana janya can be considered one of the acute manyastamba. Traumas like whiplash injury and other tractions, improper posture can also cause the acute manyastamba, and rare causes like a spontaneous cervical epidural hematoma can be reason for the manyastamba, which is an acute, what we call the, which occurs acutely. And chronic, in case of chronic, okay, especially progressive degenerations, all the progressive degenerative disease can be considered for the chronic manyastamba, like spondylosis, calcification of frozen shoulder, herniated cervical intervertebral disc, osteoarthritis of spine, drooping shoulder girdle syndrome, non-traumatic and atlantoaxial rotator, and so on. And post-trauma, okay, spontaneous intracranial hypotension can be the cause for the chronic manyastamba, and Jrimba Vegavadharana Janya. So Jrimba Vegavadharana over the period can also cause the manyastamba. So it's all more of affecting the vata movement, especially at the neck region, because of either of any of these causes. It may be a murtha or it may be amurtha. Okay, murtha means which is physically obstructing it. Amurtha is not physically obstructing, but it is still obstructing, especially anyonya avarana of the vata. Okay, so that can be the reason for the manyastamba. The same thing happens with the avabhavuka. In avabhavuka, ansamurasthita vayu, that is, especially the specification has been made. Ansamula, it can be considered as a what we call the hemoglobin, what we call the shoulder joint. And because that avabhavuka can be compared to frozen shoulder. Shira sankocha, that is a fibrosis takes place. Compression takes place. Even the what you call the subcoracoid impingement syndrome can also be considered here for avabhavuka. And bahu spandita haram, that is a fasciculation, muscle fasciculation takes place. Okay, that is whether the compression is there, especially at the shoulder joint. Okay, either by frozen shoulder or by coracoid impingement syndrome. Okay, that can be considered avabhavuka. Okay. So you can see even the avabhava can be compared to idiopathic brachial neuritis also. Because in case of idiopathic brachial neuritis, what we have seen upper respiratory tract infections can be the cause for that. Because secondary to those infections, it can appear. Surgery can be the reason. Any surgery in and around the what's called the shoulder joint. Emotional stress is another cause, and wrestling and weightlifting that is beyond their capacity. The same has been given in Avabhavaka. The etiologies are Ati Vyayama, which can be compared to wrestling and weightlifting beyond their capacity. Shoka, that emotional stress can be considered. Vyadikshamatva, that's a reduced Vyadikshamatva, especially the infection conditions, and Shastra Karma is mentioned. So Dhatu Kshaya takes place, and because of that, there is a Todana, Bhedana, Chedana, and ocean at the shoulder joint, and the same are seen in case of the idiopathic brachial neuritis, where the presence of oligoclonal bands in the CSF takes place. So oligoclonal bands are nothing but the protein, what you call the molecules or the protein strips, which are moving freely in the CSF. They are increased, the protein strips, bands. Okay. And these are the immunoglobulins, which are proteins in nature basically, and they increase in the what we call the CSF, and that causes that is because of the which are raised usually against the herpes simplex and varicella zoster virus. As a response, they are increasing in the CSF, and that can cause okay anti-ganglioside antibodies, and that may lead to mononuclear infiltrates in the brachial plexus, and that cause the intense pain. So what I mean to say that many other things, detoxification can also makes the wonder when you consider these as the toxins of the the immunoglobulin bands. Okay, so avabhavaka can be need not be only the frozen shoulder. Avabhavaka can be because of the coracoid impingement syndrome. Avabhavaka can be because of the idiopathic brachial neuritis also. So all those conditions where the functionality of the vata is affected, this movement is affected, okay, that should be considered in the avabhavaka, especially at the shoulder joint. Now I'm coming to the Vishwachi. The talam pratyangulinam yaha kandara bahupashrata says it has been shown that there is a right from the finger till that finger. Okay, right from right, let the pen start from here or come to here. So one or the same. So there, of course, many times it has been told that we used to make it as avabhavaka as the right pen reading from over downwards, and Vishwachi in the opposite direction. Okay, but it whenever the ultimate is when the Vishwachi and the radiating pain becomes more specific, and the personage-turner syndrome can be considered for Vishwachi. Neurogenic thoracic outlet syndrome can be considered for Vishwachi. Metastatic brachial flexopathy, radiation-induced brachial flexopathy, and traumatic brachial flexopathy can be considered for Vishwachi, as per my opinion. Okay, so what exactly, as I told, the whatever we can, if we sum up all these things, we found out that the basic causes are the what you call the one is the inflammation can be the major cause for the brachial neuralgia. Okay, inflammation. Secondary to either infection or any what you call reaction to the immunization or reaction to any what you call the mechanical irritation. It can be because of invasion by the neoplasms. It can be the injury tears, and it can be infiltration by the or the constriction by the scar of the infiltrants or the infiltration by the what we call the malignancies or the Pancoast syndrome or Pancoast abscess. Okay, so that all of them can lead to the brachial neuralgia. So in case of antarayama, as I was telling, manne samsrita, that is neck pain is one of the neck is the major what we call site where the disease affects. So even antarayama, what are the medications has mentioned, the antarayama and bahirayama, both of them can be considered for the manyastamba or the management of the manyastamba. Even the condition is not severe or as of the this what you call the opisthotonus. Of course, we are not going to treat opisthotonus cases, but still the management which has been mentioned in those Antarayam Bahirayam can be used for brachial neuralgia, especially with the Manyastamba Avavahaka. Okay. And what you call the brachial neuralgia with the neck stiffnesses and neck radiating pains. So now the basic thumb rule I would like to give to you, whatever may the pathology, once you understood that, you have a role to play as an Ayurvedic physician. You need to make a thumb rule. You need to understand whether Vata is Samsrishta Vata or Kevala Vata. Means whether Vata is associated with any of the what you call the dhatus, okay, or dushas, or it is single Vata. That is the first thing you need to understand, because accordingly the treatment plan changes. Second is whether this Vata Prakopa is Marga or Janya or Dhatu Shoshajanya. Dhatu Shoshajanya. If it is because of Marga or Janya, you need to clear the Marga or. If it is Dhatu Shoshajanya, then you need to do Santarpana Chikitsa. Is it? You need to do Santarpana Chikitsa. And also assess whether the Vata is in the Samavastha or Niramavastha. Because if it is in Samavastha, you need to do the Ampachana. Then only you should go with the Vata Shamaka Aushadhi. First you need to do the Amapachana, then you should go treat the Vata. If it is Niramavastha, directly go for Vata Viparita Chikitsa. Okay. And if Amapach, and the basic rule is whatever it is, even if you're not able to make out the rule, whatever changes are there, except Agni Dipana, you can use Ampachana and Vatanomana in any of the cases. In case of Agni Dipana, of course, it depends. If it is Niramavata is there and Pitta Samsrishta is there, then directly don't go for Agni Dipana medicines, because it may aggravate the burning pain or burning sensation in the patient, especially in the costa as well as at the affected site. So you need to think, if you see that there's no burning pain and there is no Pitta Samsarga, you can go for Amapachana, Agni Dipana, Vatanomana. This can become a thumb rule for you, a basic management protocol for any disease for that matter. And you need to treat the Avaraka. Now, Avaraka here is Kapha Avrata is the main. Most of the time, Kapha will be doing the Avarna with the Vata and do the treatment as per that. Okay, sometimes Pitta Avrata Vata can also occur, especially personage-turner syndrome. You can consider that with the Pitta Avrata Vata, because the Lakshanas which will be presented in that will be burning, severe burning, radiating pain will be there. So that can be Pitta Avrata Vata. Okay, so the basic thing is what? Whatever the Kshina doshas are there, you need to elevate them. Whatever the Vruddha doshas are, you need to reduce them to the equilibrium and maintain the equilibrium. Okay, so when it comes to doshik, you need to do that. So now, if we summarize this one, okay, all the brachial neuralgia conditions of modern, if I would like to summarize them, I can make in 4 what you call the categories. That is Marga Janya Vata Vruddhi, Vata Prakopa, because of that, and Dhatuksha Janya Vata Prakopa, because of what are the brachial neurology conditions can be considered, and Marga Roda leading to Dhatuksha. Sometimes what happens, the Marga Roda itself leads to Dhatuksha, whereas because the nutritions are not supplied to the distal part where from the Marga, where the Marga has happened, and because there is Dhatuksha portion is not being transferred, and Dhatuksha leading to Marga Avaroda. Many times so Dhatuksha can also in turn lead to Marga Avaroda. So if you think like that, so Marga Avarodajanya Vata Prakopa leading to brachial neuralgia, the condition can be cervical spondylolischitis, coracoid impingement syndrome, thoracic outlet syndrome, traumatic brachial plexopathy, axillary neuropathy, musculocutaneous neuropathy, long thoracic neuropathy, and osteoma. And Dhatukshajanya Vata Prakopajanya, if you consider the brachial neuralgia, in case of brachial neuralgia, condition can be idiopathic brachial neuritis. So idiopathic brachial neuritis of the brachial neuralgia can be considered as Dhatukshajanya. Okay, whereas the radiation-induced brachial flexopathy, okay, radiation-induced brachial flexopathy, because which is going to make the what you call the scar. The scar is remaining there post radiation, and that scar can infiltrate with the what you call the brachial plexus, and that can cause the marga avarodha, and that leads to the muscle dystrophy. Because when the innervation is lost, when the nerves are not, the sensory nerve as well as motor nerve functions are lost to the particular muscle fiber, that muscle fiber goes into dystrophy or the atrophy. That is what the marga or the leading to dhatu. So radiation, when the radiation is done, there is the scar. The tissue is burnt, and that infiltrates that what you call the constricts, compresses the brachial nerves, and that causes the brachial flexopathy and leading to distal part atrophy. Brachial flexopathy can be the cause. Another reason can be the condition can be considered for marga or leading to dhatu. Personage tumor, proximal neuropathies of shoulder, frozen shoulder, crown dense syndrome, aneurysm, jugular prolactasia, carotid dissection, all of them over the period, initially they are marga or rodha, then over the period, they may lead to dhatu of the distal part, and that becomes what you call the lifestyle compromising. This is for the patient. So you need to clear the marga or rodha as early as possible, and especially these things, okay, most of them, they require surgical intervention. They require surgical intervention. So the pathologies which are falling under the marga or leading to dhatu, depending upon the amount of the marga or rodha, you should make your own discrimination to whether to go for pure Ayurvedic medication management or go for an integrated approach with Ayurvedic management along with the surgical intervention. Okay. Then Dhatukshaya leading to marga or rodha, where brachial flexitis, hereditary neurologic amyotrophy, metastatic brachial flexopathy, and cervicospinal stenosis. Here, of course, here also most of means the 50% role of surgery is there, but still we can take a chance here with the Ayurvedic medication. So the pure marga or rodha, okay, where the surgery can be avoided. Pure Dhatukshaya, where the surgery is not at all required, and pure Dhatukshaya leading to marga or rodha, where the initial stage we can manage with the Ayurveda medicine. Whether marga or rodha leading to Dhatukshaya, if they are means the compression or the marga or rodha is can be is very minimal, and it doesn't cause any fatal what you call the irreversible changes, pathological changes in the patient, you can go with Ayurvedic medication. But if you feel that if the compression is more bigger, the compressing part is more bigger, and that may cause the irreversible changes with the limb, the patient may lose his functionality of the limb, then you need not to think of the take chance with the Ayurvedic medicine, directly refer it to the concerned, the expert. Okay. So Chikitsa Vikalpa, now you are left with a Bheshaja Chikitsa, that is Bahiparamarjana as well as Antaparimarjana, and Shodhana, you can go for Nash and Basti. Because classics mentioned this. Raktamoksha, in some conditions, Raktamoksha is also mentioned. Agni Karma is also mentioned. Physiotherapy can be integrated along with your medical management. And Patya play the important role, because without controlling the doshas, without correcting the Agni, you cannot achieve the result. Okay. So Bheshaja and Bahiparimarjana Chikitsa, you can go with Abhyanga with Dashmula Thaila, Prasarnadi Thaila, Karpashaya Thaila, Kotanchukai Thaila, depending upon the dosic involvement. Okay. Nadi Sweda with Dashmula Kashaya and Rasna Iranidi Kashaya give better result. And Pradeha, especially when this Kapavrata Vata is there, go for Dashanga Lepa and Doshagna Lepa. Whereas Pittavrata Vata is there, I made an Anubhuta Yoga in that lady patient, which I was talking about the initial part of my presentation, where I used Masha, Shashtikashali, St Madhu, Gokshura, Khanda Sharkara, Godhugda, and we made what you call the paste, a khichdi like, and we applied it and we got a better result. That I became an Anubhuta Yoga. And surprisingly, afterwards I went to the classics and I could found that the same contents are there in the Pradeya, and I'm honest I swear that I was not aware of this. Only after applying that, I went back to the class. That too, my students found this one. Okay. So in case of Pitta Prabhala, when the Pitta Prabhala is there, Pitta Varta Vata is there, Pitta Samsarga is there with the Vata, then you should go for that whatever I mentioned, that is Sharkara, Madhura, Madhuram. So it's all the Madhura, Tikta, Kashaya, Siddha, Ghritas you can use internally. Okay. And Parishaka can be done with the same, okay, which are with more of okay, Madhura, Shita in nature. And of course, Parishak will be with the hot water, hot kashayas. And Kshira, Sharkara, Tandulodaka, okay, Jivaniya Siddha Sarpis for the Abhyanga, okay. Even for Grita can be used for Abhyanga part. Shali Shashtika, Pradeha Grita Mishrita. So, Vata Prabhala and Sukoshna Pradeha Kare can be. So, when it is Vata Prabhala, Pitta is less. You can go for Sukoshna, Pradeha. Okay, whereas Pitta Prabhala and Vata is less. First you go for Shita, what you call that combination of both things. Okay, so Upanaha can be practiced, especially with all the snehas, using all the snehas. Okay, Kakuladi Ghana can be used. This is a classic has been. Only thing basic line is you need to do the what you call all the Madhura Siddha Gana Dravyas, whatever, either in the internal or external application, you should use them. And only thing you need to think of, means take consideration or be clear that Upanaha is contraindicated for Pitta Vrutta Vata Janya, what you call any of the brachial neuralgias. Okay. So even the management line of the Ardhita can be used here. So Mastishka, Shirobasti, Nasha, Dhuma, Upanaha, Sneha, Nadisveda, all of them can be used. For Pana and Abhyanga, you can use, okay, Yusha, Panangadi, Upayojha, means all the Kshira, Taila, and Grita can be used for this one. So Antarparimarjana or Manyastamba Vishwachana Avabhahuka, as I told you, if the Samavata is there, okay, then you should always, Sushruta says that Shadharna Yoga should be used for 7 days. First 7 days, you should use Shadharna Yoga with Sukha Ambu, that is Sukoshna Ambu. Okay, and first 7 days, you should do the Amapachana. So Shadharna Yoga can do a better Amapachana, and by that, the Niramavastha can be, Niramavatavastha can be achieved from the Samavata to Niramavata. Okay, Samavata to Niramavata. So these Gugulus, right from the Yogaraja to till the Goksara Gugulu, depending upon the condition of the patient, and because the condition means, I mean to say that depending upon the involvement of the doshas and dushas, you can select along with the what you call the Agni status. You can use Yogaraja, Trayashanga, Mahayamra, Shivanada, Amrutadi, Lakshadi, Kokshadi, and Nadi Kashaya is the best user in case of in the Keralas for all the brachial neuralgias, especially neuralgias, all the neuralgias rather. You can take Nadi Kashaya. And Kotam Chukadi Kashaya, Rasna Shuntyadi Kashaya is also used there, especially when there is what you call the Sama Vata Lakshanas are there. Okay, or Agni Mande is there. There you can use. And Erand Bilwadi Kashaya and Sarvamayantaka Ghrita is mentioned. Okay, that is Bala Muladi Ghrita. Okay, so that is a Madhur Siddha Dravyas you can use. So Shodhan therapy, as I told, Nasha can be done and Basti can be done. Okay. And in Manyastamba again, especially Vata Shleshma Hara Nasya. You need to use Vata Shleshma Hara Nasya because Kapavrata Vata is there. You need to adopt the Nasyas which are Vata Shleshma Hara. Okay. So even Balamula Digrita you can use. Kotam Chukari Kashaya Rasna Shuntadi Kashaya can be internally given. Yoga Guru and Guru can be given. So for Avabahuka, again Nasya is indicated for Avabahuka. Okay. And especially Sneha Nasha should be given after food, after the taking food. Okay. And Bhav Shirshakata Vata, where the particular or Nasha and even Pana and Basti Karma can be done. Okay. So along with again the same, you can choose the oils or the Ghrita, as I told, Madhura, Gana Siddha, Ghrita or Taila should be used. And Rakta Mokshana is mentioned in the what you call especially Gridrasi. So Avbahaka, we can consider homologous of the Gridrasi, or Vishwachi can be considered. Vishwachi can be considered as homologous of the what you call the Gridrasi. And of course, in Vishwachi also, this what you call the Kurpara, above the Kurpara Sandhi, the Rakta motion has been mentioned, and you can try it, especially with the conditions of a personage-turner syndrome. If it doesn't give the result by the all the applications, as I told, Anubhuta Yogas, as well as the Nasha and what you call the internal medication, you can go for Rakta motion, especially Pitta Vrata Vata is there, and Pitta is Ashrita in Rakta, and many times even the hematomas, like, okay, that is epidural hematoma, as we were speaking about, the spontaneous cervical epidural hematoma, and idiopathic brachial neuritis, where pitta is more involved and rakta prakopa has taken place. Herpes zoster brachial flexor neuritis, where of course, the rakta is involved again, jugular phlebactasia and aneurysms and osteoastoma. On all these conditions, rakta motion can be tried because the blood is vitiated. So rakta is vitiated because of the pitta samsarga there, and pitta happens to be ashra with the rakta, and the bloodletting will give better result with these conditions. Okay, so you can see the median cubital vein can be taken into consideration, or the brachial vein, or the what you call accessory cephalic vein and cephalic vein can be tried for the rakta moksha, and followed by a nadi kvata can be given. Nadi kvata contains dashmula, balamula, tripla, kirata tikta, rasna, jiraka, shadanga, eshtimadu, metika, devadaru, maduka, eranda. So you can see all of them there, vata shamaka and shotahara. Okay, so that can be tried. Now, advantage of Rakta Moksha over the what you call the NSAIDs, especially, is the NSAID, it has been found that the COX-2, it increase the COX-1, what you call the enzymes, and that COX-1 increase the what you call the blood clotting factors. It increase the blood clotting factors in the blood in the body, and because of that, the strokes, especially cardiac arrest as well as the brain strokes, have been found more with the study which has been published, and that means the NSAIDs for a longer period are not good. So to avoid these complications of the NSAID, especially COX-1 and COX-2 inhibitors, you can go for the where you do not get any result with all the internal medication with Ayurveda, go with the Rakta Mokshana of the affected side, the supracubital or infracubital, what you call the what you call the bloodletting. Okay. So Agni Karma is again mentioned in the Manyastamba. You can try with the Bindu Karma. I have not tried, but you can try because it has been mentioned in the Manyastamba. Okay. So we can take, that is Twang Masa Sira Snayu Sandhyasti Sthiti Atyagri Ruji Vayuvaha. So whenever there is a Snayu Sira has been mentioned in this classical what you call the Agni Karma indication. Okay. Snayu. So all the tendons, ligaments, and nerve can be considered for the Snayu. And there, Agni Karma can be done. And it's all, of course, it is practiced also in the form of the Griva Basti and in the form of the Bindu Karma along the course of the nerve. Okay, the Agni Karma, and that gives a better result. You can try that in the OPD also. Okay, so in case of Kapha Medavrata Vata, you need to do this Shotavat Chikitsa. Shotavat Chikitsa, where you need to, okay, use with the what you call the Kshara and Mutra. Kshara you can use, Gomutra you can use, okay, and Karanja Phala you can use, and Grithas, which are of Ushna and Madhura, and what you call the lighter, Laghu, in what you call the qualities can be used for the Kapha Medavrata Vata. Okay, so this Kapha Medavrata Vata Chikitsa can be considered, whether this is my thought, you just check it out, whether it can be considered or not. I have not tried, but the thought out of my mind that the herniated introvertebral disc is like a more homologous to the Medha. Okay, the disc is very soft tissue, and it is more with homologous with the Medha. And whether the Kapha Medavrata Vata, the treatment can be considered for herniated introvertebral disc, is the thought you need to give over and try it. If you get the result, let me know. Okay, but I have not got any cases of that, and that's why I have not tried. Okay, so Bahya, for Bahya Antarayama, that is you can use the Ardhitavat Chikitsa again. Okay. And Taila Druni also mentioned, not practically possible. Okay. So probable homologous, coming to the end of the presentation. I'm thankful to you for people for being so much patient listeners and attendees of this particular session, because almost it's 1.5 hours it is going on. So let me conclude for your easy, ready to use prescriptions. Okay. So that the classical, whatever the conditions we are having, the Manyastamba, Griva Hundana, modern what we call the correlation can be made with the cervical spondylodiscitis and carotid dissection. Avbahuka and Baushirshagata Vata can be compared to frozen shoulder, drooping shoulder girdle syndrome, coracoid impingement syndrome, idiopathic hypertrophic brachial neuritis, hereditary neurologic ametropy, neurogenic thoracic outlet syndrome, metastatic brachial plexopathy. And Vishwachi can be compared to all the more of the burning and more of the Pitta Samsarga Vadis, especially herpes zoster brachial plexus neuritis, chronic spontaneous cervical epidural hematoma, cervical spinal stenosis, myositis ossificans, brachial neuritis, personage-turner syndrome, idiopathic brachial neuritis, radiation-induced brachial flexopathy, aneurysm, carotid dissection, jugular phlebectasia. Whereas Antarayam Bahirayam, part of the meningitis, ankylosing spondylitis, okay, and tetanus can be treated with the medical management or the treatment protocol of the Chikasudra of the Antarayama Bahirayama. Okay, so let me conclude like this. Okay, so there are, see, the treatment we have got two types. One is Shastra Sadhya, another one is Snehadi Kriya Sadhya. And wherever the Shastra Sadhyas are there Snehadi Kriya are not contraindicated. Means you can try these Snehadi Kriyas. Okay. Even though it is Shastra Sadhya, but you can try. There is no wrong in trying the what is Snehadi Kriyas or the medical management, conservative management should be tried before going for surgery. Because Sushruta himself says that being a father of surgery, especially in case of Ashmari Chikitsa, he says that Akriyayam Dhruva Mrityu, Kriyayam Samshayo Bhavet. So, when the Sushruta himself says that Akriyayam Dhruva Mrityu, Kriyayam Samshayo, then only you should use the surgery. You should try surgical or the medical management of the Ayurveda, especially for all the brachial neuralgia. And there is a patient doesn't have the much life-threatening, what you call the complications. There is a time period. There is a what you call the you have got a what you call the opportunity. If you have got opportunity, you have got a time period where you can try your medicines. So definitely should go for. We should go for what you call the all the medications which has been mentioned, or the treatment Chikitsa Sutra mentioned. Chikitsas mentioned in case of Manyastamba, Avbauka, Griva Hundana, and Vishwachi, Manya and Antarayama, Bahirayama, all of them can be used depending upon the conditions which you can clinically correlate with the modern or the contemporary diagnosis. Okay, so brachial neuralgia is a cervical pain syndrome with varied etiologies are there, as we already went through the detailed things. Okay, ranging from congenital deformities to acquired, degenerative, infective, and traumatic events. And of course, inflammatory should also be included in this. Then Ayurvedic treatment model is mentioned in Manyastamba, Avabhavaka, Vishwachi, Vata Shonita, Ardita, and Kshavatu, Jrimba, Vegavardhajanya, Manyastamba can be better treated with palliative or curative options over non-definitive pharmacological and surgical outcomes of contemporary medicines. We got better edge. Okay, we have got better edge in these conditions. Okay, and especially when we are assisted with all the imaging, what you call the investigations from the contemporary science, if we are able to identify your limitation, your strength, your where you can play your role, if you do that, that will be what you call better option for the patients from the what you call the surgeries, and surgery should be kept at the end whenever it becomes only inevitable. Okay, so that is all with this one, and I believe that you got a better what you call the now the an insight of a brachial neuralgia. And let me close this one. Let me close this one. And I believe that this has given you what you call If you found this session as valuable, I request you to put this means in your give me the feedback, whatever you felt about this session. And also I request you to follow my Ayurpreneur Academy YouTube channel. Okay. If you are already watching this on YouTube channel, kindly subscribe for this one. And Ayurpreneur Academy is the YouTube channel will be uploaded with all the free what you call Friday, what you call this webinars. And you can join Ayurpreneur Academy by becoming a member, free member or a paid member of the Ayurpreneur Academy with this what you call the uh, purchases. You can download Ayurpreneur Lifestyle Hub mobile app from the Google Play Store. If you have got an Android mobile, if you have got an app called iOS mobile, that is Apple, you can go for Apple Store. There also it is available. And there, if you purchase any of the already means completed webinars also, which are they're still there in the front store, which are for free purchase, you will become a member of Ayurpreneur Academy and you'll be getting the links of all the future webinars whenever you would like to attend. Okay. So with this, I would like to say that thank you once again for being here and watching this session till the end. And you share your opinions, what you felt, about my particular understanding regarding the brachial neuralgia. If you resonate with my findings, you can let me know. Even if you differ from this, I request you to let me know what other things can be considered for brachial neuralgia other than what I have included in this session. So this particular session will be available in the uh, Ayurpreneur inner Ayurpreneur, what you call the inner circle alt. Okay, inner circle alt as a recordings there, and you can watch it whenever you find. Of course, it is a very elongated session, but I was not wanted. I didn't ever wanted to skip any of the slides. I wanted to give a full what you call the uh, full what you call the all the coverage I want what I made. I wanted to give it to you. So you just check it out and go through that and adapt this one, and you can have better result and you can be okay, you can check out, you can be a best expert of the neurological conditions of the Ayurveda. Okay, with that, let me conclude my